So, what is the problem that we encounter in Morocco? First off, we have a shortage of radiologists. We only have around 0.71 radiologists for 100,000 Moroccans, meaning that we lack expertise, and always the radiologist services are always full. So in order to enhance the diagnostic time, right, and also accuracy, we provided an AI solution for it. So, using deep learning algorithms, we are able to now detect up to more than 14 thoracic abnormalities in chest x-rays and different medical images. And of course, it would not only reduce the diagnostic error, but also enhance the patient treatment plans. So, of course, as mentioned, it applies machine learning algorithms. More specifically, it is a hybrid architecture between convolutional neural networks as well as vision transformers, instead of using traditional CNNs for, of course, image processing. Not only that, the data acquisition is very, very important in terms of AI. I used 224,000 chest x-rays. It's an open source data set that was acquired from Stanford. However, in order to adapt to the Moroccan demographics, then, of course, there is more to gathering data, chest x-rays that are Moroccan. So it could be adapted for the Moroccan radiologist. Think of it as a second opinion for a doctor. Not a way to replace doctors, because of course there is this misconception that AI will replace people and people will be left with no jobs. That's just a dystopic way of seeing this. Not only that, data security and confidentiality is very important between the patient and the doctor. So of course it anonymizes the DICOM and NIFT files that are from the X-ray machine. Anonymizes them, meaning that inside the metadata of these DICOM and NIFT files, it removes the patient names and replaces it with the patient ID that will be locally hosted in the radiologist's computer for security, then fed into the AI model. In terms of course, it is affordable because I provided it at 20 dirhams per diagnostic. The problem is that this technology is very expensive and computationally expensive as well. So, of course, in order to enter the market, there has to be an affordable price and, of course, speed, 6 times faster. So think of it, let's say the radiologist takes 30, 40 minutes to do the diagnostic. Well, now with Doctorial, we will be able to do it 6 times faster. And this is a prototype using Doctoria CXR, so chest x-rays. And this actually has the potential to detect micronodules. These micronodules could be a sign of tumor. And eventually, we could even have the potential to detect early stage cancer for some patients. Apart from this, it can also detect all of these thoracic abnormalities. Then we have Doctoria MRI, specifically for, of course, MRI images. I only trained it using a data set for tumors, to segment the tumor, but eventually, as I gather more and more data, it could even potentially detect Alzheimer's disease or Parkinson's disease. These are, of course, the market opportunity. There is no doubt that AI will completely revolutionize the healthcare sector. And of course, it has a compounded annual growth rate of more than 30%. My customer segments. So for now, I work with radiologists. But eventually, as I'm going to expand with Doctoria, I could target even more segments, such as, for example, insurance companies. Because as I'm going to gather more and more data, insurance companies could use this data for their uses. Hospitals and clinics could process the diagnostic time and have more patients treated with better efficiency. These are the revenue streams. In terms of, as I mentioned, for usual radiologists, it would be 20 dirhams per diagnosis. But of course, as we're going to require more diagnostics, the price will be, of course, lower. Sustainability goals. Well, not, of course, it targets the SDG 10, 3, and 9. So